Hi, good evening, everyone. Thanks for tuning in again to our segment of Dr. Sumner's Summit to Wellness. Excited to be here tonight. Our topic for tonight is diabetes, what you need to ask your doctor. So that's what we'll be discussing. Excited to be here. Definitely, as you come on in, tag, comment, and let's get things started. For those of you who don't know me, my name is Dr. Felicia Sumner. I am your board-certified family medicine physician, and I am dedicated to helping you understand your own health and then educate your communities about being well. So excited to be here tonight. Thanks so much for coming and tuning in. We'll be talking today about diabetes and the questions that you need to ask your doctor. All right, so let's get started. Tag your friends and share this with anybody who you think would benefit. We're excited to be here. All right, so really what we'll be talking tonight about is diabetes. What is diabetes? What is this insulin thing? What's the deal with insulin? Why does diabetes happen? Like, what causes diabetes to even occur? And what are some of the tests that you need done if you are diagnosed with diabetes or pre-diabetes? All right, so diabetes, as you may know, I've been throwing in a lot of tips recently about diabetes because last month, November, was American Diabetes Awareness Month. So I threw out a couple tips about diabetes, but there definitely were more questions along the way. Hopefully this will help answer some of these questions. So diabetes, as you may know, is one of the leading causes of death and morbidity and mortality in the United States. It can cause a lot of issues: blindness, nerve damage, kidney damage, heart disease, stroke, a lot of different issues if it's not controlled. So it's a major issue, and 1 in 10 Americans actually have diabetes, and that number continues to be on the rise. There are 84 million Americans who are diagnosed with prediabetes. So what prediabetes is when you are at risk of gaining diabetes within the next 10 years. So there's a lot of folks out there. And even worse than that, 80% of Americans are what we call insulin resistant. And we'll talk about what that means, but basically that also predisposes you to gaining diabetes. So 80% of Americans at this very moment are at risk of getting diabetes at some point in their lives, which is major. So we'll be talking again about what is diabetes, what tests do we order when we get diabetes, what lab tests should you be asking your doctor about if you're diagnosed with diabetes or prediabetes. So tune in. I'm glad to have you guys here. We're going to try to make this a shorter talk than they have been. I don't want to bore you guys, but I think that this information will be helpful, and we'll try to keep it between 20 to 30 minutes this time around. All right, so first let's talk about the cause of diabetes. And when we talk about the cause of diabetes, it's important for us to even understand what is insulin, right? So what do you think is the purpose of insulin? Could you type it in below if you have any idea what insulin even does? Like, why do we even mention insulin? Why do we give people insulin when they're diagnosed with diabetes? What does insulin do? So give me your comments. But basically what insulin does is it's a hormone that our body creates by our pancreas, which is an organ that sits right here, basically in the middle of our stomach. Insulin helps to bring sugar from inside your blood to inside your cells. So it brings sugar from your blood to your cells so that your cells can use that sugar, usually as a form of energy in most cases. But after you've taken in too much sugar, that's when things start to go awry, when that sugar starts to get into places that it shouldn't be, like your nerves, your blood vessels, etc. So that's what insulin does. It brings your sugar from your blood into your cells so that it can hopefully be used as fuel. So type 1 diabetes is when your pancreas does not produce enough insulin. Your pancreas has basically an ongoing attack by your immune system where it's not able to produce the insulin that it should produce. And that, unfortunately, in most cases, type 1 diabetes, that is not really curable. It's tough to prevent. It's usually in your genetics. But we are actually finding that there may be some gene therapy that may change that over time. So we'll see how that goes. Type 2 diabetes, though, which is the more common type of diabetes that we'll see in about 85 to 90% of patients with diabetes, is a very different situation. That's actually caused by a lot of carbs or a lot of sugar in the diet. And usually that's in addition to a lifestyle where you're not moving as much as you should, what we call a sedentary lifestyle. And then what that does is it ends up causing your body to become resistant to insulin. So your body is making enough insulin, your pancreas is putting out enough insulin, but because you are consuming so much sugar or so many carbs, which your body actually recognizes as sugar, you eat carbs like pastas, breads, rice, those kind of things, processed carbs, and your body will break down carbs into sugar. And so your pancreas is working, it'll produce a lot of insulin so you can bring that sugar into your cells. But if you expose your body to insulin over and over and over again, basically your body can get tired of it, and then you become resistant to the insulin that you're actually producing. So it's interesting that a lot of times, we see the treatment for type 2 diabetes is insulin, but if you think about it, it ends up being kind of silly, and we'll talk about that in more detail. But we're putting we're pumping more insulin into a body that already has too much. So we're learning over time now, actually, that we are kind of going at this the wrong way, believe it or not. And pre-diabetes is a condition, as I said, before you get to diabetes, wherein your body may likely develop diabetes within the next 10 years. But it's also a form of you not being able to break down sugar and bring it into the cells the way you should. But it's a place where your sugars are too high, but not quite high enough that we label you as having diabetes. And we actually have numbers for that. So if you'd like it for reference, we measure your sugar level, what we call glucose, and we'll say that someone has diabetes if when you're fasting, which means you haven't eaten in the last 8 hours, when you're fasting, your glucose level is 126 or higher, then we say that you have diabetes. But if your glucose number is between 100 and 125, then we actually say you have pre-diabetes. So there are numbers and cutoffs that we use. As for A1C, which is another measure of your blood sugar, then we say if your A1C is 6.5 or higher, then you have diabetes. If it's between 5.7 and 6.4, then you have pre-diabetes. So we use those numbers to help us qualify someone as having diabetes or pre-diabetes or nothing at all. But the good news with pre-diabetes is that it's actually pretty easy to turn around. Usually you just need to exercise more often, cut away the processed carbs and the sugars, and you can usually reverse the condition. But with type 2 diabetes, however, the issue again is that you don't have a problem with not enough insulin. The issue is actually that you have too much insulin. And so, in fact, there was a study that came out just a couple years ago that ended up showing that there are a number of cases where people have too much insulin, are given too much insulin to treat their diabetes, and they end up getting heart attacks and strokes. They're at a much higher risk of it, which is pretty scary when you think about it. So there's one question for sure. When you are diagnosed with prediabetes or diabetes, you should also ask your doctor, write this down, what is my fasting insulin level? Ask your doctor, what is my fasting insulin level? Because that is a level that, unfortunately, most traditional doctors, we do not think about testing for. However, it's a major indicator of where you are in this pre-diabetes, diabetes range. If your insulin level is really, really high, then why are we going to give you insulin to treat your diabetes? It doesn't make sense, again, when you really think about it. So if you have what we call insulin resistance, and there's another term for it called metabolic syndrome, which I'll go over with you, then you might have these possible symptoms. Weight gain, especially around the middle of your abdomen. So you've got, like, especially if you're a man, they'll say you have a beer belly, but you don't drink beer very often, so you'll have a lot of weight in that area. That's a marker of insulin resistance, or what we call metabolic syndrome. You could be obese. You could feel really tired or lack a lot of energy, especially after eating, what a lot of us call the itis. That actually is often an indication of metabolic syndrome or insulin resistance. Feeling that you have to eat rather frequently, like every 3 or 4 hours, just to keep your energy up, that's often an indication. If you have acne, especially past the teenage years, if you're craving carbs, like you crave pasta, you crave bread, sweets, sweetened beverages like Coca-Cola, things like that, that could be a marker of insulin resistance or metabolic syndrome. Or if you get episodes where you feel like your sugar is really low, like you feel shaky or weak, or you're emotional from your sugar being low, that also could be an indication of insulin resistance. So again, ask your doctor to test you. What is my fasting insulin level? So ask that. And it's truly one of the simplest, it's the most affordable, it's the most accurate test available for us to detect a trend towards pre-diabetes or diabetes. I actually like to call it the pre-diabetes test. So you can pick that up well before even you're diagnosed with pre-diabetes or diabetes. So it's worth getting checked out. And basically the way that works is most doctors, they'll screen for diabetes with this fasting glucose test, or even the A1C like I talked about. And if that test comes back normal, we'll say you're good to go. But in fact, the truth is that your body, in its infinite wisdom, it'll often compensate for your blood sugar by raising your insulin levels to keep your blood sugar, the A1C number, all that stuff in check. But as your insulin levels are raising, so your sugar can go into your cells over time, if your body becomes more and more resistant to insulin, then your insulin levels will be really high. And this is an indication that you are heading towards this pre-diabetes or diabetes track. And to be clear, the A1C test, the glucose test, those are very valuable. It's ideal that you kind of use all of those tests together to get the perfect roundabout picture of really where you are in that situation. So I usually like to test the fasting insulin level along with an A1C to get a full picture. So if you're getting those tested, the optimal level is less than 8. It's ideal to have it between 4 and 5, so that means that you're not creating this high insulin demand, you're not creating inflammation, you're not promoting fat to be stored throughout your body. So that's the level that you're looking for. So ask your doctor, what is my fasting insulin level? So that's number one with regards to questions you should ask your doctor. But let's talk a little bit about metabolic syndrome and what that means. We just went through some of those symptoms that you'll experience with metabolic syndrome. You'll feel tired quite frequently. You'll be craving sweets all the time. You'll get hangry quite frequently. You'll have that roundabout here in your abdomen, acne, things like that. So basically what metabolic syndrome is as your insulin resistance, it gets higher, it progresses, then your liver will actually make too much sugar and too much fat, and then the muscles along your body, they're going to be unable to burn the sugar and the fat. And so your muscles will create a hormone, a substance called glycogen. And what glycogen does is it stores your sugar into your muscles and into your liver. And then when you are creating insulin and there's a lot of sugar and fats in your bloodstream, and you don't have anywhere for that sugar to be stored because your cells are already full of too much sugar, that's when things kind of break up into fats, what we call triglycerides, and that's what will sit in your abdomen when you can't store any more fat or any more sugar anywhere else. And so that's what we call metabolic syndrome. And basically that's a group of syndromes. I hope this is not coming through backwards. I'm not sure how it looks through the camera, but it's a group of syndromes where basically you have insulin resistance, you have high triglycerides, high fats in your blood, you've got a low HDL, which is the good cholesterol in your system. You've got high blood sugar, high blood pressure, increased belly fat. That is what we call metabolic syndrome. And all you have to have is 3 of these things that I just named. Either high blood pressure, low good cholesterol, HDL, high triglycerides, which are the fats in your blood, high blood sugar, increased belly fat, so we'll measure your waist if it's above a certain number. Then if you have 3 of those things, then you're considered having metabolic syndrome. So the number 2 question to ask your doctor is, do I have metabolic syndrome? Because that's really important. That'll help you determine, is this something that, am I dealing with high blood pressure, high cholesterol, high blood sugar because I'm in this syndrome? Then that usually means that I need to take a metabolic approach to my treatment and not just necessarily a medication approach to my treatment, if that makes any sense. So diabetes, it's not a one-size-fits-all diagnosis, and for some people, it's not going to be treated well with medication. And I'm sure you've seen it with yourself, with your family members. You've been doing great with metformin for a few years, then your doctor has to add on another medication, and then in a few more years another medication, and eventually they'll be exhausted with those options. They've got to start you on insulin, and then eventually they've got to add up the insulin, increase more insulin, put on another insulin. Maybe it was just bedtime insulin, now it's 4 times a day insulin, and then it just keeps on going because we're not focused on the root issue. So hopefully ask your doctor, what is your fasting insulin level? And number 2, do I have metabolic syndrome? Another question worth asking, again, because diabetes is not a one-size-fits-all issue, is about vitamin deficiencies. Believe it or not, there are 3 vitamins and nutrients that are of extreme importance when it comes to monitoring and regulating your blood sugar in your body. One is vitamin B6. It plays a huge role in you being able to break down sugar. The other is zinc. Zinc helps you form vitamin B6 appropriately, break down vitamin B6, so that's also important. And the other is vitamin D. So vitamin B6, zinc, and vitamin D. You should ask your doctor, are you deficient in any of these nutrients or vitamins? Because if you are, it could actually be a cause of your diabetes. There are a lot of studies that support this. So vitamin B6, zinc, vitamin D, ask your doctor, are you deficient in any of these vitamins or nutrients? And we talked about type 1 diabetes, type 2 diabetes, pre-diabetes, pre-diabetes, and believe it or not, there is actually a type 3 diabetes. What? Yeah, it's been out there, that diagnosis, since 2005. There was a major study, I think it was mostly with Columbia University, but we call that brain diabetes. So we're now actually finding that if you're not able to maintain the appropriate sugar level in your brain, glucose level in your brain, it puts you at a high risk of Alzheimer's, dementia, and glaucoma. So that is what we now call brain diabetes or type 3 diabetes. So there is a lot of research now in that arena trying to figure out how we maintain insulin production even with some of the cells in our brain. So keep that in mind as well. So basically, contrary to a lot of infectious diseases, viruses, bacteria, we've got kind of these, magic pills that'll get rid of things and move things along for you. When it comes to metabolic diseases, the approach with a pill or a medication is not always going to be the answer. Certainly, as I've said many times before, medication is a great Band-Aid. It will help to quell your symptoms, but getting to the root cause is key if you really want to cure yourself. And believe you me, guys, diabetes type 2 especially, it is 100% curable. And I'm saying that because I have seen it happen. I have helped people get there many times when we take the appropriate approach. And I'm not saying it's easy, but it's doable. But I'm telling you, injecting insulin a whole bunch of times a day, I know good and well that that's not easy either. So it really depends on the approach that you want to take. But you have to use metabolic treatments to treat a metabolic disease. And that's why using fat for fuel, that is so important. And that's plant fat, animal fat. But when you are approaching a metabolic disease, you have to deal with the diet at hand. It really gets to the point that you can't follow this old paradigm of drug treatment because you're going to fail. Because remember, the glucose, it goes into the cell, and insulin resistance is when the glucose doesn't go out of the cell. So for years, we've been dealing with this paradigm of lock and key, and we think that the cell is kind of gated off, and outside the cell there's blood. And when insulin comes around, it turns the key. It opens the gate, and then the glucose, the sugar, it comes into the cell. But if insulin is there, think about this. If insulin is there, why is the sugar not going into your cell? So you can measure the insulin with the fasting insulin levels, and your insulin level is high. And you can look at the insulin receptor, and the gate's totally normal. So then with traditional medicine, we're thinking, oh, well, maybe there's something that's like messing up this mechanism here. The lock's not opening for the insulin. The glucose can't get in the cell. So there's this huge problem. And then we're saying, let's just give them more insulin. Let's just pump them with more insulin. But the problem is we're trying to pump more sugar into a cell that won't take any further sugar because we're too resistant. So, I mean, that's why we see that with my daughter decided to wake up. Hi, Isabella. So you should be like with type 2 diabetes, you'd expect that if you're not getting enough sugar into your cell, right? You don't have enough insulin to bring the sugar into your cell, then your cell should be starving. You should be skinny, right? You'd expect that. But actually with type 2 diabetes, our cells are full of excess sugar. And that's why we are, having tons of fat in our cells, etc. Okay, well, I have a special guest.
Hi.
Isabella says hi. Okay, so in type 2 diabetes, that's when you've got, your abdomen, it's full. You're dealing with this metabolic syndrome. And that's the reason why you're having this insulin resistance. So we can talk about this a little bit further. I'm giving you basically the introduction to how do we diagnose diabetes. If you're given the diagnosis of diabetes or pre-diabetes or pre-diabetes, what questions should you be asking your doctor so you can take the appropriate approach to treating yourself effectively. However, there are the right approaches and there are the not so right approaches, and I don't want to rush through that. So I think that we're going to need to do a part 2 to this next Thursday. But hopefully I've given you a few pearls to think about asking your doctor. One is, what is my fasting insulin level? 2 is, do I have metabolic syndrome? And 3, do I have the following deficiencies? Vitamin B6, zinc, and or vitamin D deficiency. All of those things are going to play a big role in how you can approach treating your diabetes along with your healthcare provider, along with your doctor. And I think that is hopefully helpful information for you guys to start out with, and I hope that you can join me for part 2 next week for us to discuss what are the right ways for us to get our sugar levels low. How can I fight diabetes? How can I get rid of this disease that you're claiming, Dr. Sumner, is 100% curable? It is. It takes diligence. It takes commitment. It takes, educating yourself. It takes being partnered with a provider, a doctor who's going to take this journey along with you. But it is. I am telling you, it is curable. So the question is there a way to treat diabetes type 2 effectively? Can we get off insulin and other medications? And the answer is yes and yes. So stay tuned for us to discuss that. What questions do you have? Please type them below. I will try to answer them now, or as you ask, I'll try to answer them along the way via response in the comments. But thanks so much for tuning in. I hope that this was helpful information so far. We'll dig a little bit deeper into the mechanism of type 2 diabetes. How does insulin work? How does it not work when we're injecting ourselves with synthetic insulin? Hopefully you can join me for that next series next Thursday. But I do hope this was helpful. Again, my name is Dr. Felicia Sumner. I'm your board-certified family medicine physician. I am dedicated to helping you get healthy, learn more about your bodies, and then educate your communities so we can all be well together. If you'd like more information, please talk to your doctor. If I'm not your doctor, if you'd like for me to be your doctor, you can find me on rowdocs.com, and we can have an online consultation to talk further if you are in the state of Georgia or Pennsylvania. And if you're not, I'd be happy to refer you to some of my wonderful colleagues along the way. All right, I hope you guys have found this information helpful, and have a fantastic night. Take care.